Welcome to our channel once again. Today, I hope everybody is fine. I want to bring to you the chains of survivor of cardiac arrest. If you've been following us, you've been discussing the step-by-step approach of what to do when there's a victim of cardiac arrest. We started from the first link is to recognize cardiac arrest. And how do you recognize if this is actually a cardiac arrest? You check for response. You tap the shoulder. Hello, are you okay? What's going on? Can you talk to me? No response. You check for pulse. Just within 10 seconds. No response. You also check for respiration. Is the chest rising and falling? And if those three things are absent, then you are dealing with cardiac arrest. What's the second link in the chain of survivor? That is activation of emergency response, and that's what I want to discuss today. In Nigerian settings, how do we activate emergency response? For instance, if you are at home and your neighbor calls, please come and see what is going on. This child is lifeless, or this man is lifeless. What do? You first of all go there, approach the man, and check for all those three signs. If it's cardiac arrest, you activate emergency response. How do you do that? You call for help. If you are lucky, your neighbor has a car, you'll be able to convey that victim into the car. And while you are in the car, you keep compressing the chest at the rate, if it's an adult, at the rate of 5 centimeters or 2 inches. If it's a child, you compress at a reduced depth of about 4 centimeters or 3.5 centimeters, depending on the diameter of the chest. But our major challenge and our major concern today is the delay in emergency response. I initially mentioned that it's when you are lucky. So what if your neighbor doesn't have a car? What if there's no nearby facility, hospital that could initially respond to this cardiac arrest victim? That is why we normally and then advocate that everybody, both the paramedics, the military, and even 2 persons in the family should know how to resuscitate a victim of cardiac arrest. So unfortunately, I just lost a sister that died through postpartum hemorrhage. She delivered in primary health care, and before you know it, she started bleeding, and then before they rushed her to the other tertiary facility, she gave up the ghost. And that has been what has been happening in our primary healthcare centers, because there's no adequate and coordinated emergency response. There's no number to call. Sometimes even the number of the 112, that's the road safety you call, before they can get to where you are, time is of the essence. The victim will have probably lost his life, and so there's not been coordinated emergency response system. Assure Hero Healthcare System has taken it upon itself to provide ambulance services, to be able to meet up this gap that we have. We are providing ambulance services so that when there is a victim of cardiac arrest or there's an emergency need, you are equally call us. Our ambulance are equipped to be able to respond to emergencies, and so that's what activating emergency response system literally means in Nigerian settings. It's a challenge. In UK, the response time is 7 minutes, and the ambulance in UK has been able to respond to 30,000 patients per year. And Nigerians are faced with more and more health challenges that needs to be responded to as that of the UK. So we hope that this gets better over time, where more organizations come in board to provide these ambulance services for emergency and coordinated emergency response. Thank you. Until next time. See you. I am Adewale Ayeni, the Managing Director of Shore Healthcare Services. Bye.